In West Pokot, the health burden of obstetric fistula is heavy. And without gynecologists and obstetricians in West Pokot's main health facilities, women suffering from fistula have to travel far and wide to seek treatment or live with it. Tonight, some of those women who've experienced a deep sense of loss share their stories.
Beatrice Kokwo and Christine Kamchia are very strong women in West Pokot County, living each day with one of the most devastating conditions affecting women is a tall order. Fistula is a false connection, hole or passageway between two bodily organs or vessels that normally do not connect. Obstetric fistula is a severe medical condition in which a fistula or hole develops between either the birth cavity and the bladder or rectum, or even both after prolonged obstructed labor with little or no medical attention. It leaves women incontinent for urine and or stool. It is referred to as the accident of childbirth. The good news is that fistula is both preventable and treatable. But the bad news is that fistula plagues the lives of thousands of women in Kenya. Globally, according to UNFPA, 2 million women are living with fistula, with 50,000 to 100,000 developing fistula each year. Women like Beatrice, who sells grains at the Makutano market in West Pokot, and Christine, who sells clothes, have experienced a deep sense of loss that has had a negative impact on their quality of life. Some cannot share the same bed with their spouses, be around people, and even though they could not show us, they have to use pieces of cloth paddings as adult diapers.
Asubuhi mimi nachipanga kupepa manguo yangu naoka kwanza, alafu napaka mafuta, mara natafuta marashi kidogo hivi ndio nichipake. Nikikuja kazini labda jioni hivi ama saa 7 hivi nikiona kama ama nirekebishe chakula, sikuli chakula mingi kwa sababu kukula ndio hiyo anakuja. Sasa anakuwa anachikaza.
Though there is no accurate data of the fistula burden in West Pokot, it is estimated that it is huge. Factors predisposing women and girls here to it include early marriage, teen pregnancies, lack of access to healthcare, home deliveries, where women labor for long and have obstructed labor, and also female genital mutilation. Elizabeth Chapatiko has lived with fistula for 36 years. Of the 8 children she delivered, only 3 have survived. For her first child, she labored at home for 2 days. By the time she received medical attention, her child, a daughter, died, and she realized that she had no control over urination or defecation.
For 36 years, I have used rags on my pants. I wash with soap because I don't want to smell around people.
Susan Sirkwar labored for 3 days. Her newborn son did not survive. She developed fistula and has lived with it for 1 year.
I went into labor on Tuesday and delivered on Thursday. My son died, and I could not control my urine.
With 100%, ya kwamba there are many. It's only that we could have kept our records only if we could manage these patients here. But since they come and they are referred, we really don't know the film. They are told when they go for this repair, they won't bear children. So we believe that there are many, but these myths are making them shy away not to come to us.
Beyond Zero hosted the West Pokot Medical Safari on the 9th of May at the Makutano Stadium in Kapenguria, serving over 5,000 people. The services included fistula repairs at the Kapenguria Referral Hospital.
Today, we launched the National Strategic Framework for Fistula that will strengthen our resolve to eradicate the burden of obstetric fistula in Kenya.
National government policies ambayo huwa nasinduliwa Nairobi kila mwaka tangu 1963. Leo simesinduliwa West Pokot hapa. Ya kwanza inaitwa National Female Genital Fistula Strategic Framework Policy. Hiyo ni Kiingereza tupu.
Fistula still remains very visible, causing untold suffering to many women. But with pre, intra and post-operative care of fistula patients, these women can have a new lease of life, where they no longer have to cope by using homemade paddings, frequent bathing, self-isolation, and limited food and water intake.
Niko tayari kuenda huko nisaidiwe, atipiwe mimi, alafu nipone, nikuje nifanye kazi yangu bila aibu, bila kuogopa, yani bila harufu yenye wateja anaweza toroka mimi.
Dorcas Wangira, Citizen TV.